Hi, welcome if you are new to my channel. My name is Miss Amenorrhea and I discuss everything health. Today I'll be talking about menstrual disorders. So what are these menstrual disorders, or what is menstrual disorders? So these are abnormal conditions that occur with a female menstrual cycle. So what are the examples of these disorders? They include dysmenorrhea, hypomenorrhagia, menorrhagia, amenorrhea, and menometrorrhagia. So we'll be discussing them individually. That takes us to what dysmenorrhea is. So dysmenorrhea, in a layman's understanding, is just painful menstruation. So this occurs as a result of the contraction of the uterine lining. This pain precedes the menses by a day to 3 days depending on your cycle and reaches its peak in 24 hours after the onset of the menses and tends to decrease in severity within 2 to 3 days of menses. So this pain is classified into two. You have the primary dysmenorrhea and the secondary dysmenorrhea. So let's talk about the primary dysmenorrhea. So the primary dysmenorrhea occurs when a chemical called prostaglandin is produced in the uterine lining, and the production of this chemical leads to contraction of the muscle and the blood vessels of the uterus. As the lining of the uterus shades, that's when the menses starts, the level of this prostaglandin tends to decrease, and that's why the pain reduces within days of the menses. So what is the treatment for this menorrhea? It can be treated using medications such as non-steroidal anti-inflammatories. And so what are the medications that can be used, or what medications under non-steroidals can be used to treat dysmenorrhea? So you have the feldin, which is also known as piroxicam. You can also use ibuprofen or mefenamic acid. Okay, so let's go to the secondary dysmenorrhea. So this secondary dysmenorrhea is caused by other medical conditions that affect the female reproductive system, such as endometriosis, adenomyosis, chronic PID, or fibroids. So I'll just break down the terms in a short form. So what is endometriosis? This is when the tissue of the lining of the uterus grows in other places where it's not supposed to be found, such as in the ovary, the fallopian tubes, and behind the uterus. So these tissues, irrespective of where they are found, tend to respond to changes in hormone. They bleed like the uterine lining does during menses. Before these tissues are not where they are meant to be, it breaks down every month, which can cause scarring of those tissues, leading to severe pain during menses. So what are fibroids? These are non-cancerous growths that develop in or around the uterus. Okay. Then adenomyosis. This is when the tissue that normally lines the uterus begins to grow in the muscular wall of the uterus. If you can remember when we treated the female reproductive system as a whole, you know the uterus has 3 layers: the perimetrium, the endo, and the myometrium. So this is when the endometrium tends to grow in the myometrium. That is literally where it is not meant to be. So that is what this is all about. Then you also have the chronic PID. PID stands for pelvic inflammatory disease. So when it's chronic, that's a long-term infection of the female reproductive system. This can affect the uterus, the fallopian tubes, or the ovary. So all these conditions lead to secondary dysmenorrhea, and the treatment for this depends on the cause. So this leads us to the treatments. So for the treatment, I divided the treatment based on the causes. Okay, so for endometriosis and adenomyosis, it can be treated with drugs such as non-steroidal anti-inflammatory. Example is Felvin. It can also be treated with hormonal medication such as birth control pills, progesterone-only medication, then can be treated with gonadotropin-releasing hormone antagonists. This medication helps to slow the growth of the uterine lining tissues. Okay, then surgery can also be the last resort depending on the extent of the problem. Then for fibroids, this needs to be removed. So the removal of this fibroid is called myomectomy. Okay, then for the chronic PID, that's the inflammatory disease, can be treated with antibiotics, and surgical interventions can be done depending on the severity of the disease. So we are moving over to the next disorder, which is HYPOMENORRHEA. So what does this mean? This is just a term that used to describe abnormal low bleeding. So when you get a total flow less than 30 mils per cycle, so it is literally termed HYPOMENORRHEA. So what are the causes of this disorder? It can be physiological. It can be due to prolonged stress. It can be caused by some syndromes known as Alzheimer's syndrome, nutritional anemia, insufficient body fat, and eating disorder. So basically, for the physiological causes, it's just something you can't stop. Examples are during breastfeeding, your body reacts differently. Then when you are approaching menopause, you don't expect to have a full-blown menses. During puberty, that's the onset of the menses as well. It's not expected to be much. So these are under the physiological causes. Then for the Alzheimer's syndrome, this is also known as intrauterine adhesions. So this is a condition that occurs when scar tissues form in the uterus. These scar tissues can occur as a result of trauma to the uterus, and this can happen after any surgery to the uterus or any intervention to the uterus, such as when cesarean section is performed, or when you have myomectomy, or even dilatation and curettage can lead to formation of scars. Then you have prolonged stress. This stress can cause suppression in the activities of the brain, thereby leading to decreased stimulations to produce hormones required for female reproductive functioning. Okay, then nutritional anemia can also lead to this, insufficient body fat, and eating disorder. So we'll be looking at the treatment for this. So the treatment can be medically, psychotherapy, or surgery. So for the medical treatment, you can make use of birth control pills, and you can also make use of iron tablets, folate, vitamin B12. That is to help treat the anemia if it was caused by anemia. Then psychotherapy, if this is caused by stress, then you actually need psychotherapy. Then surgery can be beneficial if yours is caused by Alzheimer's syndrome. So you definitely need to take off the scars. So let's look at the next disorder, which is Menorrhagia. So this is literally abnormal heavy flow and prolonged as well. This can be caused by hormonal imbalance, such as an imbalance of estrogen and progesterone or any other hormone. Then this can be caused by dysfunctions of the ovary when you have PCOS. Then problem with the uterus, which includes uterine fibroid or adenomyosis, and presence of reproductive system cancer as well, can lead to the heavy flow and the prolonged bleeding. And when you are taking medications as well, it can also cause the prolonged flow and heavy flow. So medications that can lead to this are hormonal medications such as estrogen, progesterone, or if you are on anticoagulants, this can contribute to you having heavy flows. So what are the possible treatment for this? Treatment for hormonal problems may include birth control pills, progesterone only medications. Then if it's as a result of uterine problem, medical treatment also includes the same birth control pills, progesterone only medications. Then surgical interventions can be used. Example of the surgical interventions are dilatation and curettage, myomectomy, hysterectomy. So it depends on the cause actually. Okay, so that takes us to another disorder, which is amenorrhea. So amenorrhea is defined as absence of menses. It has two types. You have the primary amenorrhea and the secondary amenorrhea. So what is a primary amenorrhea? This is absence of menstruation at the age of 16 years in a female with the presence of secondary sex characteristics. So secondary sex characteristics is you have breast, presence of pubic hair and armpit hair, at least having menstruated for one cycle, deposition of fat under the skin, buttocks or tiles. So these are the sexual characteristics I was talking about. Or absence of menses in a 14-year-old lady with the absence of secondary sex criteria. So this is grouped under the primary amenorrhea. So the secondary amenorrhea is the cessation of menses in a lady who has already established menses for at least a period of 3 cycles in the absence of pregnancy. So this is what secondary amenorrhea is. So this takes us to the causes of amenorrhea. So you have various causes of amenorrhea. You have the anatomical problem. So this anatomical problem includes absence of reproductive organ, and this basically is a problem during fetal development where you have missing part of the reproductive system. So in this case, menstruation cannot be established. Okay, then you also have abnormalities or obstructions in the vagina. Example of this is when you have imperforate hymen. So this is when the hymen covers the whole opening of the vagina. Then this leads to invisible menses. Okay. You also have transverse vaginal sputum. So this is a condition in which there is a wall of tissue running horizontally across the vagina. This creates a blockage. So definitely there's not going to be any menstruation. And then uterine scar can also lead to amenorrhea. So this leads us to another disorder. That is the eating disorder can also be a cause of amenorrhea. Stress can also be a cause. Extreme exercise, hormonal imbalance, medications, and physiological problems. We already know the physiological problems that can cause amenorrhea. So if you are pregnant, breastfeeding, or approaching menopause, you are likely to experience amenorrhea. So what are the treatment regimes for this amenorrhea? So the treatment depends on the underlying causes. Hormonal treatment includes birth control pills or any type of hormonal medication. Psychotherapy can also be a cause of treatment, that's if it's as a result of stress. Then surgery if it's as a result of abnormality in any of the reproductive organ or obstruction. So this leads us to the next disorder, which is Menometrorrhagia. So let's just split the name. So Menorrhagia is heavy uterine bleeding which occurs at irregular interval. Then Menorrhagia is irregular bleeding. So when you merge these two names together, it's going to give you an abnormal, heavy, prolonged and irregular menstrual bleeding. So what are the causes of this disorder? You have hormonal imbalance, you have uterine growth, you have adenomyosis, endometriosis, and blood clotting disorder. So we already know what hormonal imbalances are. We know what's uterine growth, that's fibroid. You know what is adenomyosis. This is when the uterine lining grows inside the muscular wall of the uterus. Then endometriosis. This is when the uterine lining grows outside the uterus, such as the fallopian tubes, ovaries, or in the pelvic. Then blood clotting disorder. When the blood cannot coagulate properly, this leads to prolonged bleeding. So what is the treatment regime for this particular disorder? The treatment for Menometrorrhagia depends on the cause as well. You have the medical, that's the use of birth control pills such as progesterone therapy. Then you can make use of anti-inflammatory as well. Then the last resort is surgery. You all know when we need surgery, that is if you're having the uterine growth. Okay. Thank you very much for staying tuned. Please don't forget to click the subscribe button and the notification bell as well to get notified when I post a new video. Please, the comment section is always open. Don't forget to ask your questions, or you can also write area of improvement or any topic you want me to discuss. Thank you very much. See you next time. Bye bye.